Medicare is running out of money, and time is running out to fix it. We need some innovative approaches to save it, and thereby give peace of mind to the seniors of today and tomorrow. The program has paid out more than it has taken in for years. That trend will worsen as the American population ages, the baby boomers retire, and the proportion of Americans under age 65 shrinks. And the longer Congress and the President wait to deal with it, the more painful the solutions will be, according to the Medicare trustees. This isn't news. We've known for years about this problem. Why hasn't anything been done about it? Actually, since the 1970s, attempts have been made to reform Medicare. One supposed fix that has been tried several times and is being tried again through the Affordable Care Act, or Obamacare, is price controls. Medicare will simply limit the reimbursement paid to doctors and hospitals. That's wrong. The overhead Medicare imposes on doctors already eats up most of their reimbursement. Reducing reimbursements can force doctors to lose money every time they see Medicare patients. A doctor facing a break-even or a deficit situation might decide to limit how many Medicare patients she takes, or the amount of time spent with each patient. Reduced access to physicians and lower quality care is not an acceptable solution. It's not fair for the government to be limiting patient access to doctors. And it's really not fair that people who have paid into Medicare all through their working years face an uncertain health insurance future. Medicare is a benefit that our seniors have earned. So here's a better idea for protecting Medicare. Let's keep it from going broke, because if it's broke, it can't help anyone. To keep costs in check, we need to give future Medicare recipients the flexibility to shop for the best coverage among a set of quality plans, plans that would compete for their business and that offer guaranteed minimum benefits. Something similar has been tried in one part of Medicare, and it's actually succeeded. I'm talking about Medicare Part D, the prescription drug benefit enacted in 2003. Under Medicare Part D, seniors are presented with private prescription drug coverage options with different premiums and deductibles. They get to choose the plan that best fits their needs. The federal government applies a certain amount of money toward their preferred plan. If seniors choose plans that cost more than the money they're allotted, then they can make up the difference themselves. A survey published last October shows that 90% of seniors are satisfied with Medicare Part D. A government service with high levels of satisfaction is pretty amazing. Even more amazing is that Medicare Part D's actual costs have been lower than government projections. Premium costs are 27% lower than anticipated. Part D costs are 40% lower than the Congressional Budget Office initially predicted. That's unheard of in a government program. Government programs always cost more than initially predicted. That's the potential power of market competition. Our proposal, first and foremost, strives to preserve quality medical care for seniors. In America, we must take care of the most vulnerable. It also seeks to preserve the peace of mind of seniors already receiving or about to receive Medicare. To that end, for those who are age 55 or older, our proposal preserves Medicare in its current fee-for-service form. No one who is in the system or near the system is going to experience any change. Our challenge is to preserve these healthcare benefits for the next generation of retirees. They will have the option of a new type of Medicare that will allow for more choice, save the government money, assure the long-term viability of the program, and protect them when they're old. Workers who turn 65 in 2024 or later could choose traditional fee-for-service Medicare, or they could direct a federal subsidy, adjusted for inflation, toward health insurance provided by a private company. Just like Medicare Part D, there would be a wide variety of pre-approved plans with guaranteed minimum benefits to choose from. Under our Medicare proposal, if they choose a plan more expensive than the subsidy, they would have to pay the difference. If they choose a less expensive plan, they would get a rebate. Just as in Part D, private companies would be competing for seniors' business and would have incentives to keep costs low by rooting out waste and fraud in the system. Liberals in Congress talk about protecting Medicare, but again, Medicare can't help anyone if it runs out of money. They are committed to the status quo, an unsustainable, one-size-fits-all Medicare program that does nothing to encourage choice and competition and controls costs only by reducing quality and access. Our plan preserves Medicare, improves quality, and controls costs by allowing seniors to make choices about their own health care. Speaking of choices, some seniors would like to opt out of Medicare and make their own accommodations for health care. But according to rules that date back to the Clinton administration, any senior that opts out of Medicare loses his or her Social Security benefits. All of them. That doesn't seem fair. After all, they've been paying into the Social Security Trust Fund for decades. They've also been paying into Medicare, but they're not asking for that money back. Allowing seniors to opt out of Medicare will save the system money. When the federal government has to pay for the health care of fewer seniors, that saves money. Even those over the age of 65 should have the freedom to manage their own health care without the government interfering.